Rhinosinusitis, a common nose disorder related to inflammation of the nasal passages and the sinus cavities. It occurs when the immune system overreacts to bacterial infection, environmental allergens, and pollutants. The common symptoms are runny nose, sneezing, nasal congestion, and watery eyes. When symptoms are severe, they can impact a person's quality of life. Let Sterimar's users share about their experiences.
I'm Frederick Lim. I'm a fried kway teow hawker. Actually, due to my nature work, I'm facing heat and smoke every day, so make my nose blockage for almost few years. Okay? So someone have introduced me this Sterimar. So I use it twice a day. Now my nose blockage have been improved a lot. Okay? So I recommend other people, especially those who smoke and elderly people, can use this product.
We invite Dr. Ng Chi Yen, a consultant ENT specialist, to share with us about rhinosinusitis and his thoughts on how to keep our nose healthy regularly. Doctor, can you please elaborate more about rhinosinusitis and what are the causes of it?
Right, so when we have patients presenting with rhinosinusitis, it's inflammation of the nose, which is called rhinitis, or inflammation of the sinuses, which is called sinusitis. More often than not, you get both together. Usually, then therefore, we call them rhinosinusitis. Sinuses are empty spaces within the skull and the facial bones. They are usually filled with air, and they act as a resonant chamber when we talk. So when they get infected, they can be filled with fluid. Right. So someone presenting with rhinosinusitis, if it's caused by infective rhinosinusitis, then it's usually caused by either a viral infection or bacterial infection. Sometimes they can present with allergic rhinosinusitis. In other words, this could be due to some kind of environmental allergens. Common allergens would include grass or tree pollens, house dust mites, fungal spores, or denders, cats or dog denders. These are common allergens. Another type of rhinosinusitis may not be infective or allergy related. They are more due to environmental pollutants or environmental dust. Those can also cause some kind of irritative rhinosinusitis.
What are the common treatments available for patients presenting with rhinosinusitis?
Common treatment we use for patients presenting with rhinosinusitis includes giving them intracortical nasal steroid spray. We also recommend nasal douching, which is evidence-based. There are also oral corticosteroids that we can use, and also antibiotics if necessary.
What is nasal douching?
So nasal douching is a term that we use to mean we use fluid to flush our nose. And the best type of fluid to use really is something which is safe for children, for adults, for pregnant lady, for elderly people. And this would usually mean that it's a natural product. And what is readily available will be, for example, sea salt water, which has been calibrated to match the salt content in our body. So that will be more comfortable. Some of these products also has some trace elements and minerals from sea salt. And it's been shown that using regular sea salt water nasal douching improves the mucociliary function of the nasal lining. That in layman's term would mean that it improves the health of the lining of the nose to allow it to carry some of our natural nasal secretions to the right place. In addition, the product should contain no preservative and therefore safe for everyday and long-term use. The packaging should also be user-friendly, convenient to use to encourage compliance.
Thank you, Dr. Ng Chi Yen, for sharing with us. To keep allergens and nasal congestion at bay, use Sterimar every day.